Bleeding during ovulation. Am I pregnant? If you experience spotting even when your period isn't due, it may be implantation bleeding, one of the first indicators of pregnancy. But mid-cycle bleeding or spotting can also be just an indicator of ovulation. Let's dive deep into this subject and find out more about bleeding during ovulation. What is mid-cycle bleeding? Mid-cycle bleeding is spotting or bleeding that occurs when your periods aren't due, for example, a week after you've got your periods. It can happen due to ovulation, abnormalities in the cervix, endometriosis, etc. Many women assume that mid-cycle bleeding is a sign of pregnancy. Ovulation spotting is a good sign of fertility, but it doesn't always mean pregnancy. How does the flow look like? Ovulation bleeding lasts for 1 or 2 days and is light pink or brownish red. The flow is light and is accompanied by cervical mucus and mild abdominal cramps. Possible causes of bleeding during ovulation. While nobody can pinpoint the exact cause of bleeding during ovulation, here are some probable causes. As the level of estrogen lowers during ovulation, the thickness of the uterine lining decreases and begins to shed the tissue. This can be the origin of the bleeding during ovulation. When an egg is released, the mature follicle bursts out of the ovary and may rupture, leading to bleeding. Rapid hormonal changes may also lead to ovulation spotting. Other causes include trying new contraceptives, vaginal dryness, vaginal injury, low thyroid levels, PCOS, STD, ovarian cyst, uterine fibroids, polyps, ectopic pregnancy and even cancer. How ovulation bleeding and pregnancy are related to each other. Ovulation bleeding indicates fertility and is the right time to try for a baby. Once you've confirmed that mid-cycle bleeding is a sign of ovulation and not a serious health condition, you can plan sexual intercourse to boost the chances of pregnancy. Now we will cover some most asking questions about bleeding during ovulation. 1. How is mid-cycle bleeding different from implantation bleeding? There are several key differences between ovulation and implantation bleeding. Mid-cycle or ovulation bleeding is characterized by light spotting and can happen if the egg ruptures in the ovary or there is a change in the level of estrogen causing the uterine lining to shed. Implantation bleeding occurs when a fertilized egg implants itself in the uterine lining. Ovulation bleeding is a sign of fertility. Implantation bleeding is an early sign of pregnancy. Ovulation bleeding happens 15 days before a period. Implantation bleeding happens 1 to 2 days before the menstrual due date. 2. How is mid-cycle bleeding and implantation bleeding different from a normal period? There are few differences between mid-cycle bleeding and a period. Some of them are: mid-cycle and implantation bleeding is pink, reddish or brown in color. Period bleeding is bright to dark red. Mid-cycle and implantation bleeding are not as heavy as periods. Both just last for a maximum of 2 days while periods typically last for 4 to 5 days. 3. What if you face severe bleeding while ovulating? If you face severe bleeding and pain, it can be a serious complication. If you have more than one cycle of bleeding, it is possible that you aren't ovulating at all. Conditions like polyps in the uterus, endometriosis and irritable cervix may be the reason behind the bleeding. You will need to reach out to a doctor immediately to perform an ultrasound and hysteroscopy and get the right diagnosis. 4. Is mid-cycle bleeding a pregnancy symptom? Mid-cycle bleeding is caused by ovulation and means that you are fertile. Trying to get pregnant when you're bleeding mid-cycle can increase your chances. However, it's not a symptom of pregnancy. 5. Can brown spotting during ovulation help you if you are trying to conceive? Brown spotting during ovulation means that the time is right to try for conception. However, if you notice brown spotting with vaginal irritation, it points to a pathological issue. You need to seek medical advice. Ovulation bleeding is common in some women and there is no reason to be alarmed about it. It doesn't usually require treatment. However, if you have mid-cycle bleeding with heavy spotting and severe cramps and discomfort, it may be due to other complications. You should consult a doctor for an ultrasound to know the cause of the bleeding.